Hello guys, here again, my YouTube family. We come again on another topic of concern, a question that many of us who are having families, many of us who are lactating mothers, many of us who are lactating single mothers. Yes, this topic is mastitis, a very rare question from several mothers. Mastitis is the infection and inflammation of the breast tissue, especially occurring in lactating mothers. Breast tissue can inflame in other circumstances. For example, gynecomastia. Gynecomastia is the inflammation or swelling of the breast tissue when you are not lactating and you don't have the hormones for breasting. Another one, lumps in the breast can be tumor, can be benign. But for this matter, let's see mastitis. Mastitis is the inflammation of the breast tissue, especially on the lactating mothers. It occurs especially in lactating mothers. Risk factors are one, diabetes. Most of the patients with diabetes are of risk factor to develop mastitis. Reason being, the nerve innervation of the breast tissue can be compromised in most of the patients, leading to diabetic mastopathy. Diabetic mastopathy is the inflammation, or rather, the benign composure of the breast tissue within the breast, resulting from collection of breast milk that curdles, rather curls within, or ferments, in other words, within the breast ducts. Within the milk duct, wherever the milk comes and attaches itself, it causes impossible for other milk to come through so that the baby can breastfeed. This causes a reaction and inflammatory process starts. Number one, diabetes. Diabetic mothers are at risk and should take these precautionary measures. Do self breast examination, SBE, every morning, or rather every day, even twice daily. Risk factor number two, cracked nipple. When you have cracked nipple, they become tender when the baby suckles. When the baby suckles, you feel a lot of pain, and this makes you isolate the breasts that have crack and just give the baby the other breast that's not affected by the crack. This makes you forget that you have two functional breasts. You start feeding the baby on the other side and forgetting that the other breast that have crack is having milk to be let down. And for exclusive breastfeeding of the baby, this causes breast engorgement with the milk and then start feeling pain. When the milk engorges, they start fermenting, curdles within the milk duct, causing the other fresh milk impersonates through for the baby to breastfeed or even express. The breast become tender, the skin around the breast changes, become red, and sometimes around the areola area and around the nipple become dark. You will find the crack even having oozing pus. Take note, when you have a cracked nipple, precautionary measure, breastfeed, express, or even massage your breast as you express. Another risk factor for mastitis, zile kama mnafinya nayo nyonyo, naitwa bra, maybe bra or leggings, something like that. Wear them tight, compressing the milk duct, causing a breach, causing a disconnect from the milk letdown through to the baby, causing the milk to attach itself, curdles, and then start fermenting. The milk collects, breast become engorged, the process of inflammation starts. Mastitis gets in. When the milk collects within the duct, it is a media of infection. And trust me, Staphylococcus aureus, the stubborn one, will be your visitor within the breast and inside the milk duct. Inflammation process will be stubborn with you. Take note. Wear spacious bras, or you can even do without them. No crime, because you are taking care of a very young, intelligent, not send anyone, care of. Another risk factor, low immunity. People living with HIV. Yes. Whenever your CD4 counts become very low, you have been exposed. Your immunity is reduced. Whenever your immunity is reduced, the microorganism opportunistic diseases will set in. The infection will come. The microorganism that causes infection, the stubborn one, Staphylococcus aureus, will come. And trust me, when the milk is engorged within the breast tissue, a media for microorganism, Staph aureus will be your visitor. And trust me, you will get mastitis. Take precautions. Precautions are self-examination of the breast every morning as you take a shower. Cracked nipples, soothe them with oil, non-perfumed. The best one, the milking oil, is better for the skin. Take precautions. Rehydrate yourself. Another precautionary measure is exclusive breastfeeding of both left and right breasts. Yes. Don't forget, young baby should and must breastfeed for exclusively 6 months. Porojo zako? Nope. Give the baby breast milk. It has several importance within it that we'll see in our next exclusion. Treatment. Treatment comes as it presents. And sometimes, if it worsens, it can be surgical, but not excision for the mastitis, or less it is cancerous. Treatment 1. Lifestyle audit. Taking shower, self breast examination. 2. Exclusive breastfeeding. Make sure that breast, when it is engorged, it is freed of the milk inside it. Breastfeed your baby within 3 hours for 20 to 30 minutes per breast as intervals of rest when the baby wants. No hurry. Breast is yours. Breast is for the baby, not for the husband. Husband, his time was then. He should have done his issues earlier. But now, the breast milk is for the child and the baby alone, exclusively for 6 months when the milk letdown is proper. Yes. Medication should be, because mastitis is